Thank you very much, and thanks to Paul and others on the board of Meditation Australia and Karen for the opportunity, and lots of people, I suppose. So this is quite new for me, in fact, a topic like this, on the basis that usually I only train or teach mental health professionals. So the purpose of meeting you today one by one and asking what you do and your interest and your occupation, how you're going to use this, is also to cue myself to the audience a little bit, and choose a different kind of a language perhaps, or terminology of certain aspects of how things work. Hopefully you will gain sufficient material to go back home or to work with some feeling of increased confidence when you meet mental health issues in your client groups or student groups. So this is about mental health awareness, but also some form of pre-interventions, because when you encounter issues arising within the meditation, you can't just say, sorry, I'm referring you. You have to deal with it on the spot. Yeah? So we'll look at that as well. Is that interesting? Mm-hmm. Okay. So more specifically, we will look at the need for awareness in mental health issues, clarification of active mechanisms in mindfulness, because when we don't know that very well, and we have basic mechanisms in minds, but it's insufficient, then we struggle with troubleshooting. We struggle with adaptation of techniques. So if we understand mechanisms better, it's a bit like a mechanic. It makes it much easier to fix something or to adjust your driving if something is broken in your car, if you understand what's broken and how it works. What are normal effects versus adverse effects? And there is a lot of confusion there. So we'll talk about this. We'll also case conceptualize the effects of mindfulness with the co-emergence model of reinforcement. Those who came to the conference and who attended a short workshop earlier this year would have heard of it already. It'll be not only a good revision but for you, but also a means of putting it in the context of today's topic. Understanding and addressing trauma and other distressing symptoms during meditation, of course, but addressing between inverted commas. Yeah? This is not a course in therapy, obviously. And I mentioned trauma because this is the most concerning aspect of what you're going to encounter, basically, and need to be careful about. Of course, there are issues of psychosis that could happen, but that's more to do with intensive courses. In your work, if you don't run intensive day-long retreats, you're less likely to encounter severe symptoms. However, trauma symptoms may emerge very quickly in just a few minutes. So we'll talk about that in particular. And precautions for minimizing harm. So as you can see here on this graph, this is a paper from Nicolas Van Dam and colleagues that appeared late last year, demonstrating here the curve, the increase, exponential increase in both scientific publications and non-scientific or more community journalistic publications. If you look at the difference, which makes sense anyway, you have about 1,150 scientific publications that took place since the mid-70s, but really it just started kicking in. Let me take my glasses. It started to kick in the mid-1990s, yeah? Properly. And look at the difference with journalistic publications. Yeah, this is about 33,000. So you have a lot of publications, and now and then I read a few about, and there's a lot of exaggerated claims, a lot of uninformed claims, enthusiastic, over-enthusiastic claims. And that's, in a way, there's a positivity in this, but it can be misleading at times. So we have to be a bit careful. According to the ABS, Australian Bureau of Statistics, about 20% of Australians aged 16 to 85 experience some mental illness in any year. But what's interesting here is that about half of those do not receive any treatment or are not diagnosed at all. This means that about 1 in 5 people in your group has a mental health condition, on average, if we use statistics that way. Yeah, on average. In one group you might have 3, in another you might have none. But on average, it's a huge percentage. And 1 in 10 is not receiving treatment, as I said earlier. So mindfulness, of course, is being taught by all sorts of teachers. All sorts, by that I mean with any sort of training. Anyone can come and train in being a meditation teacher. When it comes to mental health, treating mental health with meditation, that's a different ballgame. This is not just teaching meditation here. We're talking about treatment protocols, and we're not supposed to teach people who don't have the training to undertake therapy. So in my work, in the Mindfulness-integrated Cognitive Behaviour Therapy Institute, MiCBT Institute, we do not train anyone who's not professionally qualified mental health professional. It's just not possible. Ethically, we could not live with that, because we put people, otherwise we would put people in situations that they feel very stuck with at times. They might even be sued. That is actually predictable. And their clients may be harmed too, because they wouldn't know what to do. So when it comes to mental health issues, treating, I repeat, this is quite a different context, treating mental health conditions with a mindfulness-based intervention, recruitment for training is should be very tight to protect both parties. When it comes to general meditation teaching, then what needs to be very tight is who you take in your groups. That's what needs to be right, with a knowledge of your existing knowledge and a sincerity about it. Because there's all sorts of competing factors, such as popularity, money, all sorts of things that might contribute to hesitations. So we'll talk about that briefly, but basically, as you can see on the slide, and as you can know about yourself, school teachers, yoga teachers, business coaches, and other guides will teach meditation without particular mental health training. Given the statistics I've just mentioned earlier, you're bound to come across hurdles. There is no way around it. And you know it already if you teach. It's going to come up. And sometimes, I remember once, a colleague of mine, happily, so I didn't go too much into this, but happily said, "Oh, it's a wonderful thing, Bruno. This client, you know, he dropped out after 3 sessions. Oh no, we finished, sorry, so that's someone else. We finished the program and he never came back. Isn't that amazing, you know?" Well, how do you know anything about dropping out? What does it mean? Or finishing something. You know, what do we know about what follows? We don't do follow-up sessions. We don't call people 6 months later and say, "Well, how's it going, by the way?" Yeah, it's very rare. So we don't know what we don't know. And if someone does not turn up in the 3rd session with you, you don't know why. Yeah? So sometimes, if you're a very kind teacher and they respect you a lot, they might not tell you certain things, but they just might not come back. So it's not because we don't run in too many troubles for some time that troubles doesn't come. Yeah? So this is just a point to remember rather than a criticism. So basically, there is an issue of duty of care, and that's the point I would like to make. And of course, duty of care comes with ethics, and we can really become more aware of our duty of care as a meditation teacher. Not as a therapist, but there is still a duty of care as a meditation teacher. Depending on the meditation you teach, and again, there's meditation, some border more towards relaxation training, and some more towards exposure training. The more you move towards exposure, which has its advantages, and the more you're likely to bring up some material. With trauma, even relaxation will bring some flashbacks sometimes. So very briefly, because not necessarily, I mean, probably more in this group, but in the groups I teach, very often people are not aware of where at least mindfulness meditation comes from. I remember in Canada once, it was in Vancouver, there were about 97 or 98 people attending this workshop, and I asked a show of hand. Who knows that mindfulness meditation was taught by the Buddha 25 centuries ago? 3 people put their hand up. That was in 2013. Most people thought it was taught in America by American teachers. Yeah. So there again, I won't go into this. There's ethical issues there too, but let's leave it at that. So basically, it's probably a very different kind of group here, where in your training, you learn where things come from. And they weren't taught in Melbourne for the first time here, okay? So obviously, we all know this here. They were taught traditionally by very experienced teachers, usually monastics, yeah? But very experienced teachers. The question is today, how experienced are we? What training do we have again with that experience in mind? So, and what I mean by experience is, I don't know if you, in your training, came across the jnanas or nanas, is it, yeah? So you have different nanas, or 16 types of knowledge. Is a nana or jnana in Pali language, is a knowledge, a type of knowledge. And troubles we come across in meditations are knowledges, and they're listed there for a very long time. So when in our training we learn about them, we tend to normalize more easily what's going on and address it accordingly. When we don't know these knowledges, it's a little bit more complex, and we can easily catastrophize or misunderstand as a teacher what those knowledges are. So very experienced teachers who have their own practice. Now again, in a group of therapists, this is not always well understood because meditation is understood now as a therapy. So why would the therapist take therapy? There's nothing wrong with them. When a yoga teacher or meditation teacher outside that context teaches, usually they are practitioners. Am I right? Anyone's not practicing here? Wonderful. Wonderful. This is the first group ever for me, by the way. Even a small group is the first time that in any group, and I've been teaching since 2001, so that's a while ago, it's the first time that no one put their hand up. So it's nice to see. Unless we learn ourselves, and we learn continually because we grow through this and we encounter new things about ourselves, then it's very difficult to teach an experiential approach and suggesting experiential learning when we don't have our own experience of it. Yeah? So it was used for the purpose of integrating natural laws, not for relaxation training, not for a feel-good purpose. But it was to change decisions and actions in everyday life, to be in line with life, in line with nature. And I'll get a bit more into this in a minute, but basically being at one with nature. And that means something very specific when it comes to mindfulness meditation. At one with nature means no ego, obviously. Yeah? You can't have the two. Yeah? So understanding mindfulness training in that sense, basically in those days it was a means of purifying the mind from negativity or unwholesome issues or what was called sankharas or impurities, if you like. And that includes traumatic memories. Obviously, this is not something very pleasant to carry around, and it's been considered all the time. I mean, trauma has been in human life since humans existed. I mean, you could argue before you could call a being a human being, yeah? Before humans were humans, if you want to dichotomize things, yeah? Animals are traumatized. Trauma is part of life, isn't it? So when the Buddha taught, taught his teachings, trauma was included. There were radical long-term changes in personality traits, at least in the anecdotal evidence sets through the literature, and that can be retrieved. You can read about this. I won't talk about this today, about well-known histories of people, including criminals who were quite reformed quite quickly. It's hard to be a criminal unless you've been traumatized first, by the way. Yeah? So a definition of mindfulness, which I find quite useful, is a heightened experiential awareness in the present moment, free from reactivity and identification with the experience. So that's a little bit more comprehensive, but short enough to remember. If you don't have those mechanisms, what you have is concentration or relaxation, but you don't have mindfulness. It is a means to an end. It is not a destination. Very often it is understood as developing mindfulness. Now I am mindful, so I have mindfulness. And I see sometimes these journalistic statements that you have mindfulness. If you Google that, you probably will find that little article, you have mindfulness, or I have mindfulness. Well, what does that mean? It is a tool of investigation, a means of observing one's life and life in general in an objective way, when the self is not in the way, when past and future concerns are not in the way. It is definitely not a relaxation technique. Some aspects of mindfulness are relaxing, especially anapanasati, so mindfulness of breath, or shamatha, sometimes in the Buddhist tradition. There's slight different approach, but basically mindfulness of breath. And you can find relaxation. You can calm the mind with mindfulness of breath. But even that is an exposure to your own thoughts. And if you have trauma histories, then what you'll have is, through that, at some point, some flashbacks coming up. So it's definitely not a relaxation training. And of course, there can be confusion. If anyone trained in MBSR here, mindfulness-based stress reduction. Yeah. So when you ask people to lay down to meditate, very quickly they relax. And it becomes a snoring camp. Yeah? They don't do desensitization. Yeah. No chance. So that's out of the question. Yeah. Yeah. Unless you want to relax people, that's different. So it consists of sustained attention. I mean, there are many subtypes and different skills, and the Buddha taught many things, but the basic mechanisms, you have to sustain your attention, and a kind of attention, an objective, whatever that means. We know there's no objectivity in a subjective world and such a subjective mind of ours, but let's say more perceptual as possible and the least evaluative or judgmental as possible. Yeah. To that extent, you're more towards objectivity. As our as our eyes see, as our tongue and taste buds taste, etc., not as we remember or we want it to be. Also, another very important component is not identifying with the experience. Yeah, not making it part of me or my. Certainly not being using memory to recognize a stimulus and more discovering it in the present. And when we meditate, of course, we're talking about thoughts and sensations in the body. Because you have to recognize what is a pear from what is an apple in daily life, yes? So you have to make judgments, obviously. And the other part of the technique, if this is missing, then you've missed the plot, is equanimity. The ability to remain unperturbed by events that you come across within the framework of your mind and body as a result of objective observation. So equanimity, not taking part in a phenomenon or in an experience, just not caring so much, not being involved with it, just accepting it as it is and for what it is. So in the 1913 Old Dictionary, Webster Dictionary, there's actually a very nice explanation or at least description of equanimity. It's an ancient word, and it's even more ancient in northern India. In the Pali language, this was called upekkha, still called upekkha. Equanimity is a kind of evenness of mind, as you can read, that calm temper and firmness of mind, which is not elated, easily elated or depressed. Patience, calmness, although patience and calmness are components of equanimity, they're not equanimity. Yes, if you don't have patience and calmness, you can't develop equanimity. Yeah? Equanimity is a form of detachment. Yeah? It's quite specific. Composure has to bear misfortune with equanimity. And equanimous is the adjective. Therefore, this is important, equanimity can only develop through suffering. You can't develop equanimity unless you encounter that a prepotent response is a reactive response. Yeah? The prepotent means the response that is reflexive, that's the most likely to occur normally. Yeah? That's what you're equanimous with. If you don't have that happening, you can't develop that ability. So therefore, to develop mindfulness skills, and equanimity is a condition for that, one ought to encounter suffering during meditation. Is that making sense? Mm-hmm. If you try to make everyone happy, everyone's calm and happy and lying down on the floor and so relaxed, and when they get up, they say, "Oh, what a wonderful teacher you are. This was so excellent. I loved it." Worry. Worry about what you're doing. See the conundrum here? So on the one hand, you expect stuff to come up, if you want that terminology. On the other, you don't want it to come up in a way that's harmful, dysfunctional, and uncontrolled. So to operationalize the practice means to put it in terms that we understand scientifically and we can test, we can put to the test. So I'll do that a little bit, very briefly. How many people were at the conference last time? Oh, a fair bit. So, but also a fair bit who didn't. So if we repeat that a little bit, then it's never too much, I suppose. Concentration on breathing, that is usually producing attention regulation. If you concentrate on the breath and your mind, as you know as meditators, I won't go too much in details here, as your mind gets distracted, as we call it, in fact, you have a thought intruding. It's not that your mind gets distracted. It's just a thought calling for attention. So it polarizes your attention away from a stimulus that is less intense to a stimulus that is most intense. It's essential for survival. And the ability to focus on the breath, if you use that method, so with standard traditional anapanasati from the Theravada teaching, then you focus at the entrance of the nostrils. Many times in the Zen tradition in particular, you can use also the belly, the rise and fall of the stomach. Now we use that with kids and the elderly or people who really struggle concentrating. It's a good start. And then there's one sutta that suggests that this is not a bad idea, especially breath counting. So we'll talk about that later. So we sustain attention and we focus attention. Very important. And you have this kind of other tradition. I don't know how much this is affected by the West, but there's this open monitoring technique where you just sit there and just let anything pop up and then you pay attention to it. And another thing pop up and then you pay attention to it. Okay. So these are different techniques. I'm not talking about those. Who's practicing this open monitoring? Okay. So focused and sustained attention is quite different to open monitoring. Okay? So with that, you need to recruit very specific parts of the brain and parts that are essential for mental health. And this is called inhibition pathways or inhibitory control. And this is to do with executive network in part of the prefrontal cortex. So I don't want to go too much into that either, maybe a bit later. So this is very important. Why? Because if we sustain attention, if we train the mind to sustain attention, it means that every time an unwanted or unwished, undesired stimulus, which is a thought or a sensation, arises, and we say, and basically, no, thanks, but no thanks. I mean, why should I think a thought I didn't choose to have? Why? Who said? Who said I should? Why would I do that? Your philosophy 101, is there free will? Compare and contrast philosophers? I mean, unless you're mindful, there's no free will. It just cannot exist. Because you never know where your mind is going and whether you chose to go there. Besides this, a thought arises, okay, during meditation, could be anything. It's not a concern, you just return your attention to the breath. But after a while, wiring the brain in inhibitory areas, then this can be used outside the meditation practice when people have ruminative thinking, when people have intrusive obsessive thinking, when people have intrusive traumatic thoughts, and also, of course, intrusive voices with not active psychosis, not recommended, but schizophrenia. So this is a very important technique for mental health. Yeah? Focused and sustained attention. Metacognitive exposure is what you end up with. It is an exposure technique, not to be confused, again, with relaxation technique. Even though anapana or mindfulness or breath does put the mind at rest, but in mental health issues, it doesn't. It brings things up. And I'll explain why a little bit later. I mean, we want things to come up, by the way. Yeah. But we have to be careful. What and how much? So I mentioned inhibitory control and attention shifting. So what do? We say thanks but no thanks to that thought, and then we switch attention back. So these are called executive functions. They are studied, they are measured in the brain, they are measured with assessment and behavioral tasks, and these are very impaired in some disorders such as ADHD, for example. And the second major component of the practice is a systematic scanning of the body. When we say scanning, it's just terminology. Scanning can be misleading. It could mean that a Star Trek lover might think, beam me up, Scotty, you know what I mean by that? We don't scan with a scanner and a white light. Obviously, it's about, I can see the little nerds there, here and there. It's about feeling. So scanning is a term that I've employed as well to facilitate communication. But my principal teacher, Goenka, S.N. Goenka, used surveying, and that is actually a very accurate word, surveying the body. So surveying the body, part by part or in different ways. And again, different teachers teach it differently. And there are many types of scanning the body, ways of scanning the body. But basically, it's about feeling the body, feeling sensations in the body, and learning not only to be exposed and not evaluate with our own expectations and views and judgments, but also to not respond, to not react, to just see it for what it is. A sensation's a sensation after all. It doesn't have to be my sensation. Now, this is complex when we begin. With more experience, egolessness, or anatta, if you learn the terminology, develops slowly with the awareness that a thought is just a thought, not mine or I or me. It's just a mental event. So a microbit of what we call I, my, me, my thoughts, already we don't identify with. Every time a thought arises, we don't identify with it. We practice in small ways egolessness, with less identification with what I believe is me, my thoughts. Similarly with sensations in the body, every time we feel something in the body and we don't identify with it, we see it or feel it for what it is, just maybe a sensation of heaviness or lightness, temperature, a movement, a constriction. I'll develop that a bit further. Then it's a little bit of the self, or what we believe is the self, that we don't identify with. So day in, day out, practicing every day, not identifying with experience, helps us distance ourselves from an assumed ego, an assumed sense of self, a constructed sense of self. And of course, the less there is of that false self, and the closer you are to nature. Yeah? You remember, with mindfulness, we integrate natural laws. Okay, and of course, we prevent learned responses in the same vein. Why? Because what is the learned response to a thought? Is to think it. And the more you think a thought that intrudes in consciousness, the more you're reinforced to think it. And it's very easy to ruminate at night, not fall asleep. We're so addicted to thinking. Why? Because there are sensations that co-emerge with those, and we're addicted to feeling too. Addicted to those senses. So I won't go too fast now. But basically, the general aim is to increase, between inverted commas, self-awareness, or I would say experiential awareness, objectivity and acceptance with detachment in each experience. Now, the first step that we want to take, given the explanation of mindfulness here, brief albeit, the first step is to differentiate what is an undesired effect and what is a normal effect of mindfulness training. And I know preferably I should use the term meditation, but meditation is an umbrella term. There are so many types. Has anyone counted how many types of meditations, including Christian meditations? And there's a lot of meditations. So I tend not to use the word meditation because of the possibility of confusing people. So I use the term, or specifically mindfulness meditation. Is that okay with you? Now that might not be accurate with what you're doing on the other hand. Yeah? But I'm just letting you know that this is intentional, not a mistake, to not confuse people. It could be transcendental meditation. I'm definitely not talking about that today. And I'm not an expert in it. Actually, I'm not an expert in anything. Yeah. I'm a student like you. So the first step is to differentiate what's happening for someone. And because you're all meditators, which is wonderful, you do that yourself, so it's much easier for me to pass that on. What is an adverse effect? Because we need to understand what is adverse, very importantly. I guess we're here for that today. Is an effect or an event that is unwanted. Yeah? And it is, it is any unwanted, I'll read because I'll get jumbled up. So an adverse effect or event is any unwanted harmful effect that results from, but is not the stated goal of a given treatment. Now you may say meditation is not a treatment. We can speak from different contexts, but I would say it is a treatment, personally, against ignorance, a treatment for reactivity, negativity. We talk about mindfulness meditation anyway. Yeah? And mindfulness, according to the Satipatthana, includes vipassana meditation. Yeah? If you wondered that. So the Buddha taught mindfulness at 4 levels of information processing, or 4 levels of experience, and from that vipassana is born. So even though you may not call vipassana mindfulness, it is still a mindfulness approach. So not as a treatment as we normally intend it, but it's still a form of treatment for suffering in general. So if we have such adverse effects, it is definitely not desirable. What is then a side effect? A side effect is any unexpected effect that is secondary to the intended effect of a treatment. It's secondary. It's not that it's unwanted. It's probably expected, but that's not really what we're looking for. So you see that in your medication notice and how to use medication. Sometimes you see side effects there. It's known. It is occasionally expected, but it's not necessarily wanted. And the central effect, as I call it, is any expected pleasant or unpleasant effect that is primary to the intended effect of a treatment. Just a note on the slides so that you don't over note things. The slide PDF will be sent to you. That's still okay? Yeah, will be sent to you after the workshop. I should have said that earlier. Just to test. No, it's not. So basically, don't overdo it. If you want to add things that's not on the slide, that's fine. But no problem with the slides. You'll have them, I don't know, within the next few days, I suppose. So what are common and expected types of discomfort with mindfulness meditation? Remember that exposure-based experiences need to be normalized. Exposure, you're familiar with the term exposure? I repeat that with mindfulness properly administered and used, mindfulness meditation need to be understood as an exposure approach, which is why you have all these effects, basically, which you don't have with many other types of practices, because it's so easy to distract our mind with different types of practices. Here we're not. So by being exposed to our own depth, then these depths arise. See, there's I don't know if it's from her, but Shona Shapiro in one of her talks says, I think she got that from someone else, what you pay attention to amplifies. Have you noticed that? If you're not sure, then let's stay in silence just for 10 seconds and let's see what happens. You don't need to close your eyes. Just don't pay attention to anything in particular. Just be silent and stop paying attention to the talk, and let's see what happens. Okay, have you noticed anything? What have you noticed? Oh, the air conditioning is louder suddenly. Yeah? Okay, anything else? That's mostly it, isn't it? So if you had a fly in the room, you might have heard it if it was close to you. Because suddenly your attention changes direction, isn't it? It's no longer inhibiting auditory pathways, yeah, of that stimulus. So when we perform a task, things change in the brain. I'll talk to you a little bit about this later on in a different context. But basically, as soon as you pay attention to something, it's bound to amplify. It's a bit like a magnifying glass. So you pay attention to the breath, you feel the breath more. You pay attention to thoughts that emerge, you're aware of them more. Whereas here, you might have thoughts co-emerging with your other thoughts as you listen to this talk, and you may not be aware of them. Yeah. So we need to normalize whatever arises in the present moment. And if you are familiar with the 5 hindrances, I'm not sure of your training, so I don't know exactly what you train, but 5 hindrances are very well-known experiences during mindfulness meditation in particular, but not only, in daily life. There's still 5 hindrances. One of them is agitation, anxiety, being unstable. Oh, that happens during meditation. This needs to be normalized. There's nothing wrong with agitation, but agitation may come from symptoms of trauma. We need to make the difference. But agitation per se, people look around, take time, put their shawl 3 times on the knees, you know, they can't close their eyes easily. It's just a bit of stress, perhaps. Or sometimes it's a bit more than that. But this is one of the hindrances. If it's not addressed, then it becomes a hindrance to the practice. This is normal. This is expected. It's been actually taught for 25 centuries. Another is fatigue, drowsiness, but also a sense of laziness. We feel heavy in the body. We don't feel like practicing, or we snore. Very simple as that. So anything that encourages drowsiness, such as wrong posture, make sure this is corrected. Yeah. Intrusive obsessive thoughts. I mean, I'll go back to the 5 hindrances very briefly, although you probably a good amount here are aware of them. Another is craving. Another is aversion. So during intrusive thoughts, often co-emerging with sensations in the body, which means we have emotions coming up, then it may be thoughts that pertain to past pleasant experiences, or we expect pleasant ones to arise in the future, and we crave, and that really delays the practice and distracts. And what it does, it reinforces craving, and the same goes for aversion, hatred, and so on. So memories we have of difficult situations in the past, or we expect to be in the future, begin to emerge, and we start to feel quite frustrated, and we start to have self-talk. You know, if he does this again, I'll say that back, and we may ruminate like this and with aversion. So this again is not just a waste of time in the practice. It's also a hindrance in the sense that it prevents us to practice, but it also reinforces reactivity in daily life. Remember, meditation, what we do in meditation is, if we do it enough, is what we're about to do in daily life. Why? Because we don't change brain at the door. Yeah? It's the same brain. What you wire in one context is wired in another. And your daily life, of course, reflects the way you meditate. No difference. So those hindrances apply both within and outside the meditation practice. And the last one is doubt. 5 hindrances. Yeah? The last one is doubt. Doubt about oneself. is the worst of all, because that's almost guaranteed dropout if the student doesn't talk to the teacher about their troubles. But also doubt about the technique and doubt about the teacher. 3 types of doubts. So these are normal hindrances to be expected. Yeah? It's not a mental health condition. Intrusive thoughts, sometimes they are obsessive. You can expect them. They're very robbery. They come back over and over. And if the teacher is not aware of this, then a person can get worse during meditation. And in fact, build up anxiety because of this obsessiveness, which means that our role as teachers is to communicate with students, to ask feedback, not just to run a class and say, see you next week. We need to talk to them. How is it going? And if you see something a bit suspicious, or there's something that intuitively you feel, there's something, I better talk to them. Take them apart and talk to them one-on-one so that it's not exposed. Again, there's different types. In the work I do, of course, it's expected. I mean, this is therapy context. But in a coaching context where you want to teach executives, or you want to teach managers or team leaders in a firm, it's very difficult to ask someone, hey Jenny, there, how are things going? I notice you're doing this. You have to take them one-on-one, apart. And it's amazing what you discover when you do that. Intermittent anxiety or agitation, I mentioned that does not persist outside the context of meditation. Now, herein lies the difference between what is expected, what is normal during meditation, and what you may start to look at in terms of, a potential adverse effect. Is that if the person carries that outside the meditation and for some time or several times, then you probably can expect that they are reinforcing their distress during meditation. And we'll talk about what to do in this case. They need to stop practicing immediately, because it becomes a catastrophe very soon. So that's what I explained earlier. When you had those monastics teaching in monasteries or centers, people would not go away. They would have a meeting, one-on-one meeting with the teacher if they need. They would ask questions. You'd have an intimate relationship with each student, and this would be resolved. But nowadays, at the speed at which the expansion of teaching is, you run more and more and more into those situations and risks that they pose. So outside the meditation practice, if distress is maintained, you just want to investigate. In fact, this should be investigated earlier, as I will explain later on today. Physical pain, it's expected. If someone is in pain during meditation and you say, just lay down for a while, it's compassionate. But you may reinforce the view that pain is unacceptable. And in daily life, that person can't cope with pain. What type of pain are we talking about? I'm talking about physical pain here in this case, yeah? So physical pain, if they have an injury, if they have a knee reconstruction, you ask them to do a full lotus on the floor, this is not recommended. That's not what I'm talking about. But do you ask your clients to sit on, or students to sit on chairs? Okay, that's often the case. People, if they sit on the floor, that's fine. Pain will come, there's no issue there, it's not a question. But even sitting on chairs and pain arises, it's not abnormal. What's happening? Remind your student, when you pay attention to an experience or something, it amplifies. So, are you normally in pain? Oh, you're just sitting comfortably in a chair. Why do you think you're in pain? Well, it's because my back, Okay, roll a cushion, put it at the lower part of the, still pain. And now pain here, and now pain there. Ah, okay, well, there's something else there. This is not your posture. So in my work in Mindfulness-integrated CBT, we ask clients to do a TV experiment. You can do that too. It's not reserved for therapists. TV or book experiments for the vegans. No, no, that's fine. I border vegan too, by the way. So it's definitely not a criticism. So no, you have clients who don't like to watch TV. Perfect, no problem there. So, but they might like to read a book. So a book experiment. Most people like to watch TV, at least some funny things. So get your client to focus on the thing that entertains them most. It could be a comedy on TV, could be something pleasant to look at, not the news these days. Yeah? So something entertaining. It could be a book, could be TV, could be, I mean, that's usually the most stable stimulus that you'll have, stable between inverted commas. And ask them to sit in the posture that they normally take when they meditate. Put a little pad and note beside them and look at the clock, or put a watch beside, and just sit there still and just watch that funny show on TV or read that book, and don't move apart from moving pages. And when a need to move, irresistible need to move arises, the person takes note of the time on the pad and continues. Move a little bit if they really need to, and continues. And then compare with meditation with the same posture. Collect the data, bring it back to you. And then you can discuss it with data, not just a point of view. So now you've just implemented a behavioral task. This is typical in cognitive behavior therapy. Yeah? You implemented behavioral tasks to look for evidence that their pain comes from their posture during meditation. What do you think will happen?
They can watch TV for much longer without having to move.
How do you know that? Personal experience.
Personal experience.
That's right.
Exactly.
Right. That's right. It's not just a point of view. And you'll see, I mean, people, sometimes they cross their leg on their sofa and watch TV, and they don't move like that for a while. And you do that, 5 minutes later, they're in pain and they move all the time, when they start just observing the breath already. And we see that in courses, in intensive courses of Vipassana meditation. It's very hard not to move, and students need to learn. So, physical pain. But again, this is to be examined carefully, and an experiment like that can help the person clarify, and you clarify whether the pain, you know, am I inflicting pain to this person here, or is it really just due to their practice and they actually carry that with them all day long without knowing. Occasional nausea is also completely normal. People say, oh, I stopped because I started to have nausea. This mindfulness doesn't work for me. Well, nausea can be a memory of nausea. Yeah? Or it can be a fear, an implicit, subconscious fear of what is about to come up, which produces anxiety symptoms. And nausea is often one of those. So nausea is not a deleterious effect of meditation. And always investigate, by the way, if you say to someone, well, do you have nausea in daily life? Oh yes, I always have nausea. Well, it's not created by what you're doing here. Yes, but I feel it more. That's right. Then you can explain how to address that equanimously. Which means that you teach them to do that in daily life more equanimously, to deal with nausea. If they never have nausea, and that can happen, and they sit and they start to have nausea, then be careful. Know that it's usually normal, but be careful if there's not something else that pop up that's more to do with trauma-based symptoms. That is anxiety in this case. A sudden surge of emotion. Well, this is actually expected. If emotions don't pop up during mindfulness practice, then what is this? It's again relaxation. They are bound to arise if it's an exposure method. Emotions are bound to arise. The very central mechanism in this case of mindfulness meditation is to learn to notice it, to accept it for what it is. Emotions are also made of other things. They're compounds, they're not units in their own rights. And learn to deal with emotions equanimously. So emotions are opportunities, to the extent, of course, that the person is able to handle them. And that, again, is in the discussion of how you're doing. And again, remaining very kind, compassionate is essential in this case. Is anyone practicing loving-kindness meditation, metta bhavana? Yeah. Anyone not practicing or never heard of it? Oh, wow. No hands up. That's lovely. Changes in body temperature, again, this is expected, and often this comes with emotions. And many a times people who don't have a close relationship to their emotions may not realize that changes in body temperature are part of emotions. Unpleasant memories, and I'm not, by the way, with changes in body temperature, I'm not talking about the 1 degree that you lose when you meditate for a long time and you need blanket on your knees. That's normal. It's the same when you sleep. I'm not talking about that, of course. So unpleasant memories or flashbacks of traumatic events that do not persist outside the context of meditation. Of course, you're going to have some residue, but then the person's able to let go fairly quickly, or they're not haunted by it, they don't think about it too much. They're interested because how can you not be interested if you have flashbacks of trauma during meditation? It doesn't mean you're just going to forget just because you stand up and go to work. But the symptoms, as in intrusiveness of flashbacks, do not occur outside the meditation. That's fine. That's expected. In fact, if we don't have this, and there has been quite a lot of trauma, evidence trauma, not necessarily painful experiences, because this is bound to come up, but I'm talking about trauma, actual trauma. If that doesn't come up in mindfulness meditation, again, we shouldn't call it mindfulness meditation. It's bound to come up. Otherwise, they haven't been traumatized. They just went across difficult situations and they processed that. They integrated that quite nicely. Not everyone who has a hard life is traumatized by it. Am I correct? I know that the majority of you has had some very, very painful moments in their life. I know that. First, you're here. That is enough. Second, this is life. I like it when clients come to me, and I have a private practice as well, and I see about 25 patients or clients a week on average. And some clients say, so how was it in childhood? You know, what was your relationship with mom and dad? And I had a great childhood. You know, I was so wonderful. You know, I was feeling so loved. Okay? That's how it starts, obviously. But because that's what memory recalls. That's what selective memory chooses. Now, it doesn't mean that everyone's been miserable in life, but suffering is part of life. You cannot bypass it. For the simple reason that we suffer every time we want something that we don't get. And even more so when instead we get what we don't want. And eventually when we get what we want, it changes. So, no one escapes. Life brings suffering. So, of course, suffering comes up in practice since you're looking at life from moment to moment. And I'm not just talking about the pain of the posture here. So, as long as it does not extend and disrupt and impairs normal functioning outside the meditation, then it's expected. So, I would not panic if someone remembered their father repeatedly slapping them during meditation when they were young. It's normal. Yeah. Memories of that sort are normal. but you want to monitor things carefully. Postural confusion, that often occurs, and it is absolutely normal. I remember for a period of my life, for some years, sitting, I prefer to sit on the floor, on a cushion, sitting on the floor cross-legged, I would so often think or feel that my posture was totally crooked. So I would feel like my back is like this, my knees are there, and I open my eyes and I'm quite straight. And I remember a Thai student at the University of Tasmania, she was a master's in psychology student, and she wanted to do the foundation course in Mindfulness-integrated CBT, and she came to Australia for that from Bangkok. And she was participating weekly to this 10-week long course, and she kept complaining about feeling that she's lying down when she's sitting. I mean, Thai people are born cross-legged. I mean, this is not, it's not strange in Thailand, yeah? Although new generation sometimes it's a bit different, but this young lady knew how to sit cross-legged on the floor, and she never felt any issue with it. But practicing, she would vividly feel that she was lying down. And there was nothing to overcome that. I tried everything I could, every suggestion in the world that I could find, and still, she probably still feels that way. Maybe things have changed. But sometimes we have these really strange experiences, and I know I cannot explain that. But this is so common that I would call it, therefore, normal. And it's not dangerous, it's just weird. Okay? Have you had a bit of that? Or sometimes you feel you're a bit crooked, but it's not exactly. So I don't know if a physio will tell you, oh yes, your spine's a bit misplaced. Don't know. But certainly it's very common. Common types of adverse effects. Feeling harmed by the meditation practice. Even though the person may not be harmed, if the person feels harmed, this is not good. We need to be very careful, because it's going to escalate. Yep. So we need to clarify this very quickly. What do we do if a person feels harm? Well, what aspect are you feeling harmed by? Well, everything. Well, yeah, sometimes it's like this. Yeah, everything, and you need to clarify. This is a very generic statement, feeling harmed, but you have so many possibilities. Like every time I sit down, I feel vulnerable because I'm sitting down. Well, what do you mean by that? Well, at school, I was always little and everyone was bigger than me, and every time I sat down, and they would bully me, I felt frightened, and then here you have some traumatic elements coming in. So feeling harm could mean also feeling sensations and catastrophizing them. Feeling harm can be, quite feasible with someone who is psychotic or bordering psychotic, who has had psychosis in the past. So this is definitely something you want to pay attention to. Feeling harmed. When someone says, I'm afraid that it hurts me, or I'm feeling harmed by this, stop immediately. I mean, I'm not into the step of giving a suggestion at this point, so I won't go into too much of that, but this is definitely something to recognize as an adverse effect. A prolonged, and this is important, prolonged sense of losing control over one's mind and emotion. This is adverse. This is harmful. This is not a normal thing of meditation, when it's prolonged loss of control. Because when there is a sense of losing control, and control of what, by the way? I mean, we don't try to control thoughts or emotions. Yeah? But if the person senses that they don't have control over their attention during the practice, and that loss of control is maintained outside the practice, it is definitely an adverse effect. And how do we know that unless we ask? Okay, you're struggling, I can see here during your practice. And how was it this morning when you arrived? When you came from home, were you okay when you walked or took the bus? How was it? Oh no, in the bus I was panicking. You see, I'm still sweating because I'm going to sit here and I'm going to lose control again. Okay. And how long have you been experiencing this for, etc.? So we need to investigate this very carefully because you'll end up with someone hospitalized very quickly. Why? Because they're going to go to their GP, even if they don't have mental health professional, who will say, okay, you need to see your psychiatrist, and they don't muck about. Yeah. Okay. So this is something to be careful about. Prolonged sense of losing control. Symptoms of anxiety, dissociation. Anxiety is normal. Dissociation can be normal. Mania, delusion, psychosis, or suicidality born from the meditation practice that persists outside or once the practice ends or ceases. That's important. Anything can come up in practice. Sometimes people, even my colleagues, say, oh my God, no, I think he was manic during the practice. He thought he was, lifting off his body, and actually they don't realize this is normal features of meditation when you're more advanced. But that can also be a dissociative state. So to differentiate the two is not easy. But if this stops as soon as we open our eyes and walk about and this is gone, then this is not necessarily an adverse effect. It could be the onset of one if it is systematically in each meditation practice. So you want to monitor the frequency of that. On the other hand, what people often don't realize and therefore start to catastrophize with their client is that this may simply be a memory of mania, a memory of psychosis, a memory of dissociation that is recovered through meditation. Then that makes it a normal, expected, and even central effect of the practice. Do you understand what I mean here? Because memories of all sorts arise. Anything that's stored in memory and that can be retrieved, voluntarily or not, is potentially a good candidate for intrusion during meditation. And that can be even the memory of an onset of psychosis. And usually that scares the meditator. They will soon drop out, or if the relationship is good and you notice things, you talk to them, they'll talk to you and say, look, this is what's happening every time I practice. Every time? I mean the last 3 times. Okay, so you practice already, 15 sessions with me, and that's the last 3 times. Okay, good. That's already a good sign. And the last 3 times, what happened? Well, I think I'm losing my mind a bit. What do you mean by that? Well, I think there's some animals in my neck trying to go dig into my neck. Okay, how many times? You want to make sure. Have you had that in the past? Never? Okay. So, and then you take precautions. I'll talk to you about that later. Yeah? So you want to check. So there's precautions where you can make them practice open eyes and shorter sessions and see how that goes. Okay? But they shouldn't be scared of it, because if they're scared of it, you reinforce that fear and that avoidance again. If they've had that many times in the past, it's quite reassuring, because it probably is a flashback. But if they identify with the phenomenon and use the same response that they did then, they might engage into a psychotic episode, and you don't want that. So we don't want active psychosis in meditation groups. Stop immediately. Give it a rest. If there's nothing that's really an alarm bell, okay, there's no need to refer if that stops outside the meditation practice. Just give it a rest for a couple of weeks and see with 5 minutes with you in the room, meditation works. If that's okay, it was just a memory and it's gone. Usually someone with a history of psychosis, I would stay away. If you don't have mental health training, stay away from it. I would not teach meditation unless, as I said, you're a therapist and you know what you're doing. But many a times, so suicidality If it's a memory, a flashback of when they were suicidal, yeah, and how it felt bad, it's okay. But if they start to be suicidal and during the meditation they wonder about dying, that is not okay. This is an adverse effect now. Yeah? See the difference? Okay. And delusions also, that can be addressed. But again, I would stay away. Just with psychosis, it's the same thing. I would not advise you touch it at all, personally. And if, okay, we'll talk about referral later. So increasing symptoms of anxiety and or dissociative states that occur between frequent meditation sessions. This is adverse. So if we case conceptualize briefly, I'll do my best, with the 5 aggregates. Are you familiar with the 5 aggregates of the mind in traditional Buddhist psychology? Vijnana, etc. No, so no, doesn't ring a bell. Okay, so okay, that model of reinforcement basically explains behavior maintenance and its change in terms of the experience we have from moment to moment. My computer is capricious. Ah, I know why. Okay. It went ahead without me. Okay. And it relies on integrative or interdependent principles where mind and body cannot be separated within the same experience. So someone who has a certain type of thought is bound to have a corresponding sensation in the body. If you don't have thoughts that matter to us, arising independently from the body. And if you're familiar with embodied cognition research, then have a look in this if you're interested in that. It integrates and emphasizes natural laws such as impermanence and therefore the impermanence of self, or egolessness as we call it traditionally. So would you agree with the notion that everything changes, or is there a problem with that? Okay, is that not new? Okay. So that's very important for us to know, yeah, that everything changes, including unpleasant experiences. So a stimulus or a situation arises, and it can be external, but here in meditation it is internal, right? Unless it's a fly that annoys your meditator. Yeah. So a stimulus, we call it a situation for clients, and of course we know that because we perceive it. Yeah? If it is raining right now, how do we know that? You hear it, you touch it, you smell it eventually, you see it. Okay, so your senses, right? And then we have to make sense of our senses, or to make sense of the stimulus. So we make sense by evaluating. And this is done automatically. We have parts of the brain that recognize those situations as being, say, rain or sun or whatever. And then we give meaning to make sense of the world. If we couldn't give meaning to situations, we'd be, what, newborn babies? Perhaps they might give meaning, though, some basic meaning, like mommy's here, I'm safe. Yeah? But without language, it's very hard to give meaning to anything. So meaning comes usually when we begin to process language, as in cognitive meaning. So we evaluate situations. And to the extent that the situation is evaluated as being important to us, you know, personally significant, in other words, taps the self areas of the brain, then to that extent it triggers other parts of the brain which let us feel sensations in the body. But before we get to sensations, this part of the brain is very important. We're talking about the evaluation system here. Because the evaluation system is always based on what we know. Yeah, the mind will do this for survival purposes. It will translate the fur of an animal in the bush as something we know. Oh, what if it's a grizzly bear? Yeah, because I know a grizzly bear. I can't say, what if it's a furry alien? That wouldn't work. Yeah, it's just meaningless. And if it's meaningless, it doesn't promote my survival as a species. So it has to be meaningful for me to be safe as a species. So I give it meaning, even though I may be completely wrong. So we judge situations according to our memories, our beliefs, our personality, our expectations, our needs, our religion, our schemas, belief systems. And this is related to what we call the default mode network, which activates when we don't perform a task. Right? So now you're listening to the voice and the explanations, and you look at the pictures and things like this. You process that information. And if I stay silent for 30 seconds, or maybe a couple of minutes, then it's no longer that which you process. Is that in relation to what you know? Does it fit? Does it meet my model? Does it fit what I know? I know, or what I heard. It's very hard not to associate stimuli that we encounter with the self. So when we rest, which is why I said if we don't talk for 2 minutes, when we rest the mind, when we put someone in a scanner and we say, wait for us, we're going to set up the machine and we'll be ready in a minute. And actually that's the experiment. Actually we take the measurements while they think we're preparing. It's all ready before they arrive. But we take the measurement while they settle down and just wait there patiently. This part of the brain comes up, the default mode network. And it's called that way because it comes up by default when we don't perform a task. And this very part of the brain is typically activated when anything related to the self arises in consciousness. So, that's important, isn't it? If you don't perform a task, the self arises, want it or not. Unless, of course, you meditate in the right way. Because you can meditate and let that and bring it all to the self if you're not careful. That would not be mindfulness meditation. So when we don't perform any task, by default, the medial prefrontal cortex and other parts of the brain, so the so-called default mode, the really center of the brain right here, activates. You can see it, it's repeated over 400 times in experiments. And it's very interesting to note that part of that network, especially in the posterior cingulate cortex, are autobiographical memories, the memory of who we are, our past, what happened to us all our life. Isn't that a lot of what happens in meditation when we, all this stuff comes up? That's not the only part of the default mode network. There are other parts, the medial prefrontal cortex, for example, which makes judgments and decisions. So you have this past, you have this judgment, and they interact. So you have judging according to our past. Judgments are always based on the self, and the self is maintained through holding on to that past, not the present moment. That's why you often hear meditation teachers mentioning this monkey mind, jumping from past to future, but not. Why? Because when you begin meditation, you're not very good at focusing in the present, which means a task. It's a demanding task. I repeat, it's not relaxation. It's a very specific task of close monitoring from moment to moment in a focused manner. And whether you survey the body or you stay static on the breath, the thing is that you can encounter some of these processing, but not get into it or caught into it, which as you can guess, reinforces our past, if you do. So daydreaming is part of this. Daydreaming, what do we do when we daydream? Or ruminate at night instead of sleeping? We activate neurons associated with the self, because these are the neurons that pop up. You're not processing any personal task here. Therefore, this me network activates. If we get caught in it, the sense of self is being reinforced. You cannot forget who you are. And that is also, in my view, a survival principle, but from an ego space, if you like. So you also don't forget your clan. You don't forget your in-group. You don't forget who's part of your group. So from a social survival perspective, we survive through this. So reinforcement of the ego, but also our memories, and sometimes they're traumatic, happens when we do nothing. So doing nothing in the name of mindfulness, you're going the other way. It's worse than just doing exercise. Important to keep in mind. Once you have a bit of neuroscience in mind, it really helps to know, what am I doing with my students? Are they working hard so they don't get caught in that self? Or are they just snoring? Yeah? Okay. And also theory of mind, or guessing what people think, it's the same thing, and guessing what people feel. So it's not just me here, me network, it's also the ability to assess people and the environment in relation to me, in relation to what I think, or I think they should be or should think or should not, etc. Is that an enemy? Is that someone who's having a go at me or not, etc. So it's so me. It's not mini-me, this is maxi-me. And there are disruptions in that default mode network in a lot of conditions, because that default mode network also is important for good processing. Yeah? It's not because it's me that it's necessarily negative. Yeah? So this is disrupted in autism spectrum disorder, Alzheimer's disease, post-traumatic stress disorder, big disruption, because we can't get into the accurate memory of what really happened during my traumatic event. There is a suppression of that me network, in fact, giving place to the amygdala and other parts of the brain that keep on producing that event as if it was happening now. We can't process the fact that this was the past. So there's disruptions in many conditions, and also with chronic pain. It is now midday already. What I might do, can I grab another 10 minutes of your time before on lunch? Because you have a long lunch. We don't need so much, do we? Yeah, but we'll have enough lunch. But 10 minutes, would that be okay? We started a bit late, waiting for everyone. So I'll continue on that, because I'd like to finish this rather than split it in the middle, so you have a thorough view before you go for lunch, and you can reflect upon that a little bit before we come back. So let's say we've taken something personally now, inadvertently, of course. This is the rain. Well, how can I take the rain personally? You know how we do that. Oh, the rain again. You know, I wanted to go to the beach. I wanted to go to the beach. You know, if you're a farmer in Western Australia growing potatoes, you also take the rain personally. Ah, my potatoes will grow. You know, you don't weep thinking, oh, these people in Melbourne, I'm so sorry for them. Okay, my potatoes will grow, but I'm so sorry for you guys. You don't think like that, yeah? Okay, so when we process information in that way, which is quasi-inevitable, which means we take the information as being important to the self, then with that default mode network, especially the ventromedial prefrontal cortex, the lower part here that you can see right down there, with that part, it always interacts with the amygdala, and it is dependent upon what happens between the amygdala, which is a deep deeply situated limbic area of the brain that is associated with stress responses and defensiveness and reactivity. But in between the ventromedial prefrontal cortex, right here, just below here, it's not actually there specified, ventromedial, you just have medial prefrontal cortex, but the ventral is, ventre in French means belly, yeah? So the belly of the, underneath the brain, just here in the middle, you have this part that will inhibit the amygdala or communicate with the amygdala as to whether something is worth reacting to or not. This is your evaluation part. But between that and the amygdala, you have the insular cortex, which insulates the limbic system, and it works as a go-between this judgmentality and that deep inside reactivity. And this is where we feel sensations in the body. And this is demonstrated. It's called a network. It's called the salience network. I don't want to go too much into it, which is disrupted in mental health disorders. So here we are, co-emerging body sensations. As soon as we make a judgment, or you can call it Vedana if you prefer the proper terminology, and what you have are co-emerging body sensations because of the evaluation that was made. So sometimes the evaluation, when you meditate, you don't necessarily judge your meditation experience. They are memories of judgments. Understand? Mm-hmm. Since we've judged life all our life, what are you going to get? So you meditate and you start to remember, oh, why did she say that to me? That's a judgment. And co-emerging with that will be an unpleasant sensation. It's automatic. Why? Because I'll talk to that to you a bit later about it. But what is stored in memory in a co-emergent way is retrieved in a co-emergent way. That's why when you meditate, you have the retrieval of both sensations and corresponding thoughts. But sometimes you're not conscious of one or the other, but they're both there. They've been encoded and stored in a co-emergent way. So you get both. And that's why you get nausea, all sorts of symptoms. They're associated with those past events. So the evaluation may be agreeable, disagreeable. I mean, that's normal, isn't it? You like or you don't like something. It may be more and more personal for some people, or at some times for some stimuli, or it may not be taken as personally as other stimuli. So the rain, you might not care too much today. You're inside and you don't have a silk shirt on the drying. What do you call that? Your clothesline. So it's not a big deal. But then you go out here for lunch and you forgot your umbrella. Suddenly it becomes a big deal. The same stimulus changes according to what it means to you. So to the extent that we take something personally, even during meditation, oh my God, my pain. Oh, my pain. You know, the person didn't have good psychoeducation on pain and meditation. Suddenly they start to catastrophize their bulging discs. And so that's it. Now they start to visualize their disc coming out of socket, and they'll stay paralyzed for the rest of their life if they don't move the body or sit on a chair. Familiar? Yeah. And if we've done that ourselves, guess what we do with our students? Oh, no, just sit in the sofa. You'll be right. And then what's next? So it's no pain, then it's a bit of nausea, and then there's no more meditation. It becomes relaxation, doesn't it? Okay, so we have to be careful what we're doing and why we're doing it. So to the extent that we take something personally, to that extent that sensation is intense. Why? Because of the firing of neurons between those pathways. The more that part of the brain is activating with a sense of judgment of threat, for example, then the insular cortex is going to be very activated, and the amygdala follows suit. You change the whole posture, or whatever it is that you do. Storm out of the room because it's unbearable. To the extent that the thought is agreeable, to that extent the sensation is pleasant. If the thought is disagreeable, the sensation is unpleasant. So there you have what corresponds to then craving and aversion as a result of that. But it is worth mentioning that in my previous slide that this is how research has noticed that the sense of self occurs through sensations in the body. No sensation in the body, no sense of self. Because the self is associated with sensations, from what I've explained earlier. And that's where you get into trouble with self-harm and dissociative states. Some of my clients who have severe anxiety, who start mindfulness training, can be quite dissociated at times. So then that's up to me how I address that. And I can't guess what's going to happen until it does happen. And if you're not careful and you don't pay careful attention to this, because you didn't take a history, for example, who takes a history of their clients? Who doesn't? Yeah, don't put your hand up. It's okay, it's okay. But you're not going to take a history of a group of executives who work at BHP necessarily, right? Mistake, big mistake. Remember, 1 in 5. And you don't know which one. So, and sometimes it's the boss. So you need to make sure you take a history. Make sure you take a history. So basically, to the extent that the sensation is intense, I will react. Why? Because this is the way of the brain to escape threats for the species, reacting. This is quite primitive, and that's how it works. So we react. We react to remove ourselves from the threatening situation. And for the meditator, it's a meditation. So what do? They stand up, leave the room, they become disruptive, etc. There could be all sorts of symptoms. And this is the reaction. So again, I won't go too much into brain details here, but the reaction, if the reaction serves to decrease the intensity of unpleasant sensations, then what do I do next? When I feel these sensations in the body, what do I do next? I react in the same way because it worked. Yeah? If I feel some discomfort and I have traumatic symptoms and they're quite intense, but I'm quite socially compliant and I'm easily ashamed, I'm easily embarrassed, I have a kind of a bit of a social anxiety, and I start to have these strong symptoms, my reaction is to dissociate or stay here and not talk about it because it's embarrassing. So it can go the other way if you're not careful. And you think, oh, this person's so calm. I don't understand why he or she is flushed all the time or sweaty when I shake their hands, but so peaceful when they meditate. So reaction can be anything, but it is always, that you can be sure of, an attempt to decrease unpleasant sensation or increase pleasant ones. Yep. So it can be alcohol use, it can be anything, but not to escape the stimulus. This is important. That's why I'm explaining all this. So to have that mechanism in mind helps a lot in decision making when things don't go so well. It is not to escape the stimulus, it's to escape the sensation in the body. So in therapy it's very powerful to know that. Yeah? For example, in avoidant behavior. So are you really avoiding public speaking? Are you really avoiding the spider in the basement? Are you really avoiding driving? Or are you avoiding their consequences in the body? So once you understand that, then you can start to conceptualize exposure therapy in a completely different way. That if people are becoming less reactive to sensations in the body, they're going to be less, apparently, because they never were, apparently reactive to the stimuli that led to that, to those sensations, right? There's no more meaning in reacting to stimuli where there's no sensations in the body. So, meditation practice, therefore, is a means of desensitization and a useful one to know, because when someone's a bit in trouble, they feel some difficulties, a bit of anxiety, what do we do? Do we tell them to act externally, like change posture or whatever else you may think about? Or do we ask them to desensitize from reacting to sensations? Makes a difference? But that is a training. This is a training. This is exposure therapy, just inwardly. Yeah? It is a training. You need training. You need supervision if you don't have enough training. And from someone who's well trained, you need to look at the hierarchy, the lineage. You need to know all these things, otherwise you really don't know. So from a therapy perspective, we do that all the time. Like it's a daily business. So it's very strict. We tell people you need to train and we need to supervise you, etc., etc. With clients. But in your case, it's very loose-goose, in some ways, isn't it? You have trainers, which is wonderful. Many people don't even have trainers. They just read a book, even if it's mine. It's not good enough. Many people don't have trainers, and they face very complex situations, and they put themselves in very difficult situations for their sake, not just the students or the client. It's especially, I guess you all care, otherwise you wouldn't do what you do. Then you won't sleep well if things start to go pear-shaped. So it's very important you get that supervision and training. But especially when it comes to exposure, what do I expose to? What is it? If you scare every student away because they have bits of this and bits of that, in the name of mental health, then there's no more practice. But if they have issues arising due to mental health issues or antecedents, and you bark at the wrong tree by not doing exposure to the right stuff, then they won't shift, they won't change. And it's either getting worse, or you may tell them that maybe they need a rest from meditation for maybe a few weeks or something like, or a few months. But if you can do exposure, there and then, within twice 30 seconds, it's resolved. That's how quick you can be. So I think we can, we can leave it at that at this point. So craving and aversion, of course, will reinforce the tendency to react, as I mentioned earlier. And we'll see a bit later how we prevent this. Any questions or before you leave? No? You're good? Act as reinforcer, because if I crave for a pleasant sensation I just had, say it's not even pleasant, say it's the relief, it's negative reinforcement, so the relief of pain or emotional pain. I have a beer, say that I drink, or 2 or 3, yeah? How do I feel in the body? Much better. Well, I think I do feel better. What do you think I'll do next time? The same. So, in this case, it's aversion, isn't it? I have aversion towards this. Yeah? But what if my problem with alcohol is not about aversion, it's about craving? I'm addicted to it, and I really look at the time while I'm finishing work, it's time to go for a drink. It's 5 o'clock, it's my reward, people say. It's my reward, I deserve the drink. So this is now craving. And that craving is unpleasant. Craving is not pleasant. It's not. If you examine craving, it's actually not pleasant at all, unless you fulfill it. So the fulfillment of a craving is a kind of relief, and that is also reinforcing. Next time you want to feel relief, you drink again. Okay, it's the same with meditation. You realize that after 15 minutes it becomes unpleasant. Then you stop at 15 minutes. And then it's very hard to extend because you've been reinforcing your relief through stopping the meditation. Now, no more thoughts, no more pain, no more this, no more that. Okay? Let's leave it at that. We come back at 1 o'clock. Is that sufficient? Welcome back. Did you have a good lunch? Yeah. Ready for the last trait? Actually, it's a bit chunky, so Stay with me. There's a few to cover, a few points, but I think the bulk of the understanding that distress comes from our reaction to sensations in the body is there already. Yes, you got that? Okay. It changes quite a lot of an approach to know that. So these four components, they function in equilibrium when everything goes well. I mean, there's always a few waves on the ocean, as you know. That's part of the ocean. Emotions are always more or less triggered. That's normal. Without emotions, by the way, research shows we could not be rational. Did you know that? If someone tells you, oh, you're so emotional, you're so irrational, yes and no. Well, deprive someone from any emotion and you'll see how irrational they become. They can't have compassion, they can't make decisions that make social sense. Yeah. So severe autism, for example, where there are emotions, don't get me wrong, but they disconnected emotions. Yeah, it's very difficult to be rational. Yeah? Maybe very, very high intelligence in some ways, but certainly not emotional intelligence. These four components function in equilibrium when normal functioning is present, but disequilibrium state occurs when we are stressed. And that disequilibrium may be very momentary, very short, or it may be learned. So here's a representation of that disequilibrium state, where attention is polarized to the functions that are most useful for survival. And often it produces rapid decision under threat, for example. But it's not very good if we get used to be in disequilibrium state, just as a stress response can be learned sometimes. We can be chronically stressed, chronically anxious, chronically depressed. That applies to all disequilibrium states. It's not just an anxiety response. Anything that is deemed dysfunctional, behaviorally or emotionally. So, to give you an example, what would you do with a furry thing behind the bush that may appear to be a grizzly bear or a rabbit? Would you say, well, hang on, I'm a zoologist or I'm a cognitive psychologist, I'm going to be rational about the whole thing here? It could be a grizzly bear, but then again, you know, this is middle of the bush in Canada. I'm not sure. It could be a rabbit, could be something furry. Now, just imagine that you think like this, but it's 30,000 years ago, and your clan was decimated before your eyes by grizzly bears. What do you think? Is it a rabbit? You still the same scenario. Okay, so you hide, you freeze, you don't run with grizzly bears usually, but you're panicky. Yeah. So essentially what happens is, I don't know if we see the arrow, yeah. So there is not much point in detecting the actuality of a stimulus if it's ambiguous, right? My grizzly bear is ambiguous. I don't know. But it becomes very useful to remember what it could be like and what it was like 15 years ago when my clan was decimated. So I overjudge. See that default mode network, remembering my life, remembering me, it's based on me, isn't it? I'll decide whether it's a grizzly bear based on me, on my experience. So sensory perception, which is the more objectivity part of the mind, is shrunk, and it's no longer what it is, but what it is like. Yeah? Oh, that's like a grizzly bear. And then very quickly, as soon as you say that, and we are not very able to feel sensations in the body, even though we may have panic symptoms, we react. Why don't we feel common sensations? Because we feel only the very gross ones that make us react. If you're about to run for your life, do you feel a mosquito bite on your forehead? Would you feel it now, if you were bitten now? Yeah. So the arousal state in this case, but it can be also dissociative states. It could be deep depression or catatonic state. You don't feel much sensations when you're distressed. But we judge and react quickly. It's much quicker. It can save your life. Paradoxically, perhaps. But then this equilibrium state needs to return to normal state. The problem is when it doesn't. When we are used to maintain that disequilibrium state. And in neuroscience, we talk about the dysfunction of the salience network. Salience is what makes you feel sensations, and there's strong evidence of wide range impairment in that domain in mental health. So your clients, your students who come to meditate with you, who have mental health conditions, will probably tell you that they have either very strong sensations that are very unpleasant, or, because that's all they feel, or they can't feel anything for ages. Difficult to feel. Why? Because you could call it, in our modern days, a degree of dissociative state or dissociation. So what we're talking about here is dissociation. We can't pay attention properly, we can't focus properly, we're forgetful, and it's not just getting older, we're talking at any age. You can have an 18-year-old who just can't study because she can't pay attention. Yeah? If you push this to trauma issues, of course it's in trauma too, but this doesn't have to be traumatic. Yeah? Just a disequilibrium state between components. In other words, in our mind, if we are insufficiently paying attention to stimuli as they are, so using our senses, and that includes sensations in the body. But here, see the difference between sensations in the body here and sensations in the body here is that these ones are caused by the evaluation. Very important. The Buddha gave a very important but very short talk to monks one day. It's called the Salata Sutta, or the Dart Sutta, or the Arrow Sutta, depending on the translation. When monks said, okay, great, but what about pain? Yeah, what is pain? Is it Vedana? Is it sensations? How does it work? And the Buddha explained, so he used a lot of metaphors, because you have all sort of different levels of education in India, in those days anyway. And he said, okay, for the, what did he call it? The worldling, I don't know what is a worldling, probably a human being. The worldling, there are two darts with pain. One dart, dart or an arrow, the sting of the arrow, if you like. So one is the first one, the pain itself. And there's a second one, mental pain, if you call it the way we use language today, mental pain, due to the first pain. But for the educated, or the bhikkhus, or the monks, or whoever is educated in this field, there is only one, just the first one, not a second. See, here is the first one here, with, say, pain. You bang your knee in the chair, or you have indeed a bulging disc, as we mentioned earlier. Okay, so you feel pain. It's there. This is due to the stimulus, all right? Stimulus may be contact with a solid substrate or furniture, etc. You hurt yourself. And then the evaluation immediately arises. Oh, what if I broke my knee? I think I tore my tendon here. Oh dear. And that judgment that nobody cares about the neighbors touring their tendon. but my tendon is important. So evaluation here co-emerges then with a second set of sensations. That has nothing to do with the first one. The first one was due to the stimulus. This is what I've just been thinking. That produces sensations in the body. Yeah? And this is also, by the way, a sensory perception. Okay? So you have to perceive. It's called interoceptive awareness or interoception. And they're slightly different pathways than the first here, but they emerge from thinking. So they take a different route. And what we react to is not this one, unless you are hit with, when you go to your doctor and they check your reflexes. Yeah, well, that's different. That's very automatic. Whereas here, the reaction is based on the secondary sensation. And this, as I said, is co-emergent with evaluation. So when you meditate, what is the stimulus? Could be a thought, could be a sensation in the body, right? Let's go through this, yeah? So you have a thought or a sensation in the body, you just observe the breath. The stimulus is the emerging thought. How do I know there is a thought? Well, I have to think it, I have to know. Without proliferating that thought, I need to know there's a thought. So that's, in Buddhist psychology, thinking is a sense, by the way. You have 6 senses, you don't have 5. So we sense it. But what if what we sense, or the thought, is a memory of strong events in life, say, traumatic event? Then the thought, the stimulus here that we perceive, has been stored in memory then in a co-emergent way, with its co-emerging sensation at the time. Therefore, the retrieval of that memory is co-emergent. In other words, the stimulus is not just a thought, it's also a corresponding sensation in the body. If we are not aware because of, well, lack of equanimity, due to stress, or whatever it is, we're not aware of this, then we fall into either catastrophic thinking or any unhelpful thoughts. It can be ruminating, it can be awfulizing, personalizing, mind reading, whatever you can imagine are unhelpful thinking, is unhelpful thinking. And that adds to the already recovered or retrieved co-emerging sensations. You add another layer, and layer upon layer upon layer of reinforcement takes place. So a disequilibrium state is a learning state. And where is the learning taking place? Through the reaction. If now, because I react so quickly without feeling much, if my reaction relieves me from what I don't even feel consciously, or feel but in a biased way, I'm not equanimous, I'm not objective. Remember, I don't feel clearly here. This sensory perception is not very available. I'm not really even understanding this is a sensation. It's not my leg tearing apart. That was my second Vipassana course. I thought my foot was going out of my leg. So of course, in this case, I'm going to react. So the problem here is not that reactivity. The problem is the learned reactivity. Yeah, that's the problem. So the system is set off balance by stressors, but it can be taught to remain or maintain a state of disequilibrium state. This is why I said earlier, it is not just the distress between, say the discomfort, that's a better word, during meditation that matters, is outside the meditation. So does it mean within the meditation, have they maintained a disequilibrium state sufficiently to experience it outside the meditation? So if outside the meditation, due to meditating, you find that that person is overreactive, is perhaps catastrophic. You understand catastrophizing? Great. And perhaps is acting a bit too dramatic and reactive, and you see this happening, double check their meditation practice. They're not practicing well at all. You can be sure of that. And on the other hand, you'll have people who say, oh God, my practice is so hard. I suffer, I struggle, my pain here, pain there. And all these thoughts, you didn't tell me that. You told me I was going to feel great and relaxed. And you didn't tell me it was so difficult. Yeah, I know, it's difficult. And how was your week? Oh, great. Much better than the week before. Well, there you go. Yeah. And that's what you see very often. Why? Because the disequilibrium state did not carry over outside the meditation practice. In other words, during meditation, they kept on recreating equilibrium when memories created disequilibrium. Do you understand that? So retrieve memories and even pain. You sit on the floor, you feel pain. Pain. Is it the first time in your life that you feel pain? No. So that very pain, sitting on the floor, might trigger some memories of pain and how you dealt with pain in the past. And now you have a disequilibrium state. If you recreate equilibrium, you're fine. We call it learning to deal with pain smilingly, yeah, if you like, to put it simply. But from a neurological perspective, what you're doing is creating more and more flexibility in those neural networks, which enable you to, in daily life, recreate an equilibrium state when you're distressed or in pain. Okay, so there is strong evidence of that, strong evidence of impaired salience. In other words, where the co-emerging sensations or interoception is impaired, actually impaired and smaller in the insular cortex. You have less firing up on an fMRI in people with mental health disorders, and including PTSD, sorry. Actually, ADHD, I have some strong suspicion of that as well. So learned disequilibrium is associated with mental health disorders. The more stable and established is the disequilibrium state, and the more chronic the condition is likely to be, or the more likely it is for the personality, problematic personality, to be maintained. A problematic personality is also a disequilibrium state. It's a reactive state. And these are just some of the studies that demonstrate that. This is strong, including 2 papers on suicidality, showing that I know of, there's probably more, showing decreased insular activation. In other words, decreased ability to feel sensations in the body. Again, you'll have those slides, so you can check out those papers quite easily. So that constitutes a rationale for mindfulness training, where learned disequilibrium can lead to psychopathology. The other way around, re-establish equilibrium, creates decreased reactivity, decreased judgmentality. So you're bound to feel better in life, just simply speaking already. And therefore it resists psychopathology. So there's evidence of that daily practice of mindfulness training leads to neuroplasticity in several networks, which facilitates the transfer of the skills on the cushion to daily life. Yeah? If your brain doesn't change, you lose the skills when you open your eyes and stand up again. Yeah? So mindfulness meditation produces that equilibrium state where systematic body scanning or surveying the body, or vipassana as we call it, or we develop vipassana, the ability to see clearly, helps develop the ability to feel sensations in the body. Okay, so scanning does that. If you do shamatha, samadhi, you don't do that, you don't produce that. Yes, it is true also that people just with anapanasati or mindfulness of breath do feel the body, but unless you survey the body, you'll feel only the growth sensations. And the suppressed ones, or the ones that we tend, when traumatized, to dissociate from, they won't come up. Yeah. Or not easily. So I'm tempted to cite some passages of suttas, but I'll hold back because of time. But the Buddha was very clear about feeling the entire body as he breathes in and breathe out. Very clear about surveying the body. So Socratic dialogue is often used, in mental health, challenging the people's views that they don't have time for practice, etc. And we encourage them to also using Socratic dialogue to sit despite some discomfort. I'm not talking about mental health issues here. So there's evidence of neuroplasticity in 8 regions of the brain when we create equilibrium state, and evidence of efficacy. Actually, there's a nice review here. If anyone was interested, I'm reviewing it myself, so leave it here, please, if you look at it. But that's a nice review from late last year, titled Mindfulness-Based Treatments for Post-Traumatic Stress Disorder, a review of the treatment literature and neurobiological evidence. And it's published in the Journal of Psychiatry and Neuroscience, clearly showing medium to strong side effects, so good size of change, good effects with PTSD. But then again, you have to be careful of the traps. And this is Boyd et al. As listed there. So what we're looking for is really this, recreating that balance. And the main aim is usually explained to at least clients of mental health services, trying to recreate an equilibrium state or a recalibration in the nervous system. Because if you really look carefully, people are people. I mean, what is a disease? What is there's not too many of those. As soon as you recreate balance in the system, people change, and they change quite quick. Someone with a chronic condition who thought who have been told they have that for life, within 3 months, it's often resolved, even very chronic condition. But without that equilibrium state, relapse is very highly to occur. So why am I showing you this? Because I want to case conceptualize with someone who's not taking it well. What does it look like with that model? So of course, well-being is promoted by equilibrium state. The more healthy and relaxed individuals tend to have subtle sensations, feel subtle sensations, and know their thoughts, and therefore correct them when they're not helpful. There's strong evidence that daily training in mindfulness practice produces neuroplasticity. The role of interoception in spontaneous memory is something today to really get right. Yeah. Why are sensations so important when we teach meditation? Who teaches some way of scanning the body? Yeah, most of you. Okay. So it is not just awareness. Yeah, this is crucial. Awareness can make things worse. As I said, the more you pay attention to something, the more it amplifies. Yeah? And what matters is the response and the interpretation and the response. Yeah? Awareness alone can backfire, and that's why you have all these abreactions in many meditation courses, because they're aware but they're not equanimous. Yeah. And to be equanimous, you have to understand what you need to be equanimous to. You say, no, I can't bear this pain. Okay, I'll be equanimous to my pain. Well, we missed the boat already. I can't be equanimous to my pain because I don't have my pain. They're just sensations of a certain type, and they're not mine. So that understanding needs to be there. Yeah? Okay, so what I mean here is that co-emergence encoding, I mentioned that earlier. The encoding means the transformation of stimuli into a code that goes through nerve, say if it's visual perception, into the optic nerve and goes to the occipital lobe, and then we have an image. Yeah? So that's the encoding. With memory, it's the same. You have a situation, we memorize. The process of memorizing is a process first of encoding and then storing. You don't have a little box. Yeah? It's just neural networks firing together in a way that becomes meaningful to the human being. So if we encode in a co-emergent way, then it is stored in a co-emergent way. That's why PTSD is so painful, because they don't just remember, they relive the experience because of that co-emergent aspect of the memory. So they relive the experience, and therefore it is retrieved in a co-emergent way, hence the reliving. So it acts as a memory cue. When we scan the body, again, very important point, we scan through our past because of that co-emergence. It is because we co-emergently stored significant memories, significant to the self, memories in our mind, that when we scan the body, we automatically have memories back. Do you understand? Because we're bound to come across sensations that are similar to those we encoded even 20 years ago. So this is going to come up. That is why it's very normal to have discomfort. And those memories, and the strong ones, will be associated with what makes us decide of our life, about our life. You know, what those schemas, those belief systems. You might remember something from childhood, for example, that somehow determined the course of your life. Well, I can't trust men. Men will leave me. Actually, love will betray me. And you develop an avoidant style of attachment, an insecure attachment. Love will hurt. Love will betray me. Just because mom and dad divorced, and then you ended up in, custody of the state or something like that, and you have a flashback of this. This may have been a determining moment. If the sensation associated with that, when it will keep on recurring, because this one will, it's not just a one-off, and you don't react to these sensations, then this which determined that view, that schema, that belief system that love is not worth it, it's going to hurt you, people can't be trusted, this will disappear. Because it's always maintained by the same type of sensations. Follow me? They're crucial sensations in the body. In fact, the Buddha, no, I'll stay with my topic. It's so tempting. We need a 5-day workshop here. Okay, body scanning is therefore bound to trigger congruent memories, including traumatic memories. This you need to know. I'm building an argument here, by the way, so you know where I'm going with that. Yeah, you need to know that you are bound to come across traumatic memories in your students. It's not like, will I get unlucky like my friend? It's guaranteed. This process needs to be welcomed and normalized, not avoided and feared. Because you do worse if you avoid and fear. Because then now your student is in big trouble, and they panic and they go to the hospital, whatever happens, however their choice may be. So there's a way of quickly de-escalating arousal. So beginners also need more assistance, much more than those who come to see you habitually for the last 2 years, or 2 months for that matter. Beginners will get stuck in the default mode network, because they don't know how to focus properly. So that daydreaming and that network that by default comes up when we don't perform a task, this is going to come up much more often in beginners than in those who are experienced. Therefore, they're caught up in memories, and, as you know, as you were a beginner once. So self-organization of thoughts, also this is very important. Why thoughts intrude? Why do they come up? Here is an interesting set of information, perhaps, that pertain to neurology, but it doesn't have to be. Just think of it this way. Thoughts depend on the brain as well, right? You know about Alzheimer's, and you don't have many memories when some parts of the brains are damaged. So someone with a car accident will also damage certain part of the brain, and they won't have certain types of thoughts, if given the area of the damage. So intrusive thoughts can be explained in terms of networks of neurons competing for access to consciousness. Because there's millions of thoughts, actually more than that. I counted, based on the stats that I knew, about a bit over 1 billion thoughts have been significant to us in our life. That's a lot of thoughts. Yeah, which means that they co-emerge with sensations. So some have decayed seriously, some have decayed moderately, some have not decayed at all. The ones rehearsed and the ones with a stronger sensation in the body do not decay easily. And the idea of some co-emergence with sensations is to not forget what has been important in life. So what thought will come up is determined by the strength of their activations, those network activations. The stronger neurons are firing and connecting with each other with that particular thought, and the more you're likely that this thought is going to come up first in your meditation practice. Have you noticed when you meditate, the first thought that tend to come are the thought of recently activated concerns? Yeah, so tonight you'll have a group sit. You probably remember some of our interaction or what happened here today. First, because it's been recently activated. That's the recency effect, or recency of use, is one reason for intrusive thoughts. So think of this also from our topic today. If the first thing that someone remembers or think about when they sit closed eyes is something that happened to them 20 years ago, it's because they think of it all the time. And that is a frequency effect. It's not because of the meditation per se. It's because they have rehearsed either avoiding it or practicing it. Yeah? So they've been thinking about it recently or frequently. And then you ask, you say, oh, wow, 20 years ago, it just came like this in 2 minutes. How often do you think about that? Oh, every day. now you're a bit absolved, so to speak. Yeah? You feel much better. Oh, it's not me. Okay. But you need to ask these things. And the third reason for intrusive thought, that we know, there may be more, is co-emergent effect, or the depth of activation. If the amygdala, or deep in the limbic system, there were activated neurons with that event, then that created strong sensations in the body. It's not just the color of my father's mustache. Yeah? It's the color of my father's mustache when he was frightening me. Whoa, yes, then suddenly the mustache is not just a mustache, it's these sensations when I remember the mustache. That's co-emergence. But how is it placed in that context, co-emergence? Say you're sitting here and you feel a sensation, you just say heaviness in the stomach, you ate very heavy Indian food, a bit oily, this one, and you loved it, so you had a second and a third, and you feel very heavy, and then you forgot to close the window behind you, and it's Tasmania, so you have a bit of a cold neck, and the combination of that cold neck, heavy belly, and whatever else may be at this point in your body become sufficiently similar to a memory you had 20 years ago, bang, you have a flashback. Because then sensations in the body become memory cue. Just like music become memory cue, or smell or taste become memory cue. I tasted your wonderful chai, and suddenly I had a flashback of being in India. That's how it is. Yeah? So there's a competition for access to consciousness, which means that the more activated those neurons, due to these three reasons, yeah, whichever reason out of these three, and maybe more than one, sometimes you have the three of them. Yeah? Someone who's always hypervigilant because of trauma issues has frequency of use, it's also been recent, and it always triggers sensations in the body. So you have the three reasons. One case is guaranteed to experience this is obsessive-compulsive disorder. The obsession is so frequent that it is recent because it's frequent, and it's also very scary. It's also whether people are afraid of contamination or whatever else. So OCD sufferers are very stuck in their condition. It's very hard to shake it out of them because of these. So you can see here that people who start meditation are struggling much more with the default mode network than those who are more experienced. Here you can see the default mode, so you have the prefrontal cortex, the posterior cingulate cortex, as you can see here from the bottom, from underneath the brain. Okay, medial prefrontal cortex and posterior cingulate cortex, A and B. And C and D represent the performance, I better wear my glasses, hang on. The performance of meditators, and this is, we're talking about the default mode network. Bold is the oxygenation level of the brain, so it's fMRI basically. So here you have the three methods used, whether it is choiceless awareness, loving kindness, or anapanasati, or mindfulness or breath. You know, the meditators activate far less these parts of the brain. So here, this is here, by the way. This graph here is for what is circled here. So the medial prefrontal cortex is far less activated with meditators than with novices, those who have never meditated and try to meditate. Can you see that? How they activate that me network more easily? Yeah. Again, you see that disequilibrium here more easily. There's much more judgmental, much more caught up in themselves, etc., than the experienced meditators. And this is the same with the posterior cingulate cortex. So across the board and across meditation techniques, you see the same pattern. So they need more assistance to get out of themselves, so to speak, and stay in the experience of the present moment. To case conceptualize this briefly, I'll go back here just in a minute. This is a middle-aged man with a history of childhood, physical abuse and dysregulated mood, who started practicing with unilateral part-by-part body scanning, 2 to 3 inches diameter spots of attention. Yeah, you've done. Anyone does vipassana here? Or? Oh, so a fair few. Okay, let's have a look at case conceptualizing his experience with the co-emergence model. So here the stimulus is, while scanning the body, he feels a sensation of tightness in the neck. Don't read too fast before. Stay with me if you can. You'll spoil the party otherwise. And I'm a slow reader. So accompanied by memories of his father's big hand tightening his neck. Okay, well that's a flashback, and it is a co-emergent one because it's important to him. So I can feel, so when you ask him, how do you know you're feeling this? How did you know it was it? It's not just pressure, because you made an association there. But how do we know this is real? It's a real memory. I can feel his hand shaking my neck, and I hear his scary voice. And the evaluation, so what did it mean to you? That's how we ask, that's how we talk to people. What did it mean to you? He is so nasty. And if that were true, what would that mean to you? Well, I wish he loved me, but he didn't. And what did that mean to you? Well, no one really. So we're talking about schema using what a technique called the downward arrow in cognitive therapy, which means looking at what created what made this possible. In other words, what would that mean if that were true? Okay? And being very careful not to say, what does it mean? If it's true, if it were true, you don't reinforce the person's belief that it is true, that his father doesn't love him, for example. So if that were true, what would that mean to you? Well, no one really loves me or loved me for who I am. And if that were true, what would that mean to you? People just take advantage. And if that were the case, what would be the implication, or what would that mean to you? Well, I can't trust anyone. We are very far away from his father shaking his neck here. I can't trust anyone. Can you see what happened here? Now, we tap into a core schema. How do you know that? Have a look at this. He, I, and then no one, people, and I. And soon as you start having I, then you have implicational code, the default mode network comes in, and you have strong sensations in the body. That's where you start to get arousal and the likelihood of reactivity. So, because it becomes an I business, it's no longer my father problem here. Can you see that? Co-imaging, well, how does it make you feel to think this way, we ask. Impossible to translate that in Chinese. I tried in Hong Kong. They can't, they have to make 2 sentences. Yeah. How does it make you feel to think this way? But for us it makes sense, isn't it? Well, numb, he said. Numb everywhere except for burning heat in my face. Quite angry. And what do you do to make yourself feel better? Or what would you like to do? Or what did you do, depending on the context? Well, I'm so angry with him, I hate him. How can an adult treat kids like this? I won't talk to him ever again. Thus, ruminating can trigger the perception of more memories, of abuse, and new cycle starts. Because once you react like this and you harbor those sensations instead of letting them decrease, then they also become triggers for more memories of similar sensations, and you have a chain reactivity. Similarly, you can have the opposite with extinction. Yeah? You feel this, you don't react, it's still a memory, you're still feeling it. So because you're feeling it so clearly, it also triggers memories of feeling it before, but you don't react, and you don't react, you don't react. Well, after that meditation session and the next following days, life feels a bit lighter. But if you shy away thinking, oh my God, I refer that to a psychologist, then you've misunderstood central effects with deleterious effects. They're not the same. Yeah? So here's another way. When the person is in equilibrium state this time, not disequilibrium, while scanning the body, he feels sensation, same story. So the stimulus is the same. The sensation, the perception is feeling constriction in the neck accompanied by memory of hearing his father speaking to him. That's objective perception. He has not personalized. You know. I'm having a flashback because the sensation in the neck feels the same as when Dad shook me when I was 15. The co-imaging sensations, visceral sensation in the abdomen, they're still there because, remember, those sensations were associated with that memory anyway, so they're bound to come anyway, yeah? No matter how objective we are. And felt as, the visceral sensations felt as tightness and motion, so the kind of butterflies in the stomach and maybe some heat in the face as well, and hands and chest, some movements. And increased heart rate, due to increased heart rate. And the reaction or the response for this person in this case is keeping focus on the 4 characteristics of body sensations, or the 4 so-called elements. I won't bombard you too much today with too many concepts and decomposition of emotions, but basically is to remain equanimous. So, an important understanding about trauma symptoms during meditation is the element of nowness. Nowness means it's not a painful memory I have, it's happening now. It's reliving it. It's a sense of happening now. So it's not just vague flashbacks in memory. Because of the strong, intense sensations, remember, trauma, in traumatic experiences, people will tend to suppress sensations, even though they're very strong. You remember that disequilibrium state? The sensations, the interoception is very small following the evaluation, right? And yet, but that's just due to dissociative state. It doesn't mean there are no sensations. They are actually very strong sensations. If you measure heart rate, if you measure finger pulse, if you measure all sorts of, take all sorts of measure, you'll find that the person is highly reactive, the amygdala is all over the place, but they don't feel much. Yeah? So when they retrieve the experience, it's very shocking. It's like being there, and the tendency is to want to dissociate as well, because it's like being there. So poor ability to update memory. This is then, this is not now. This is part of what I was explaining earlier, that there is a dysfunction of the default mode network where the memory tracks, and also in the hippocampus, the memory tracks there, which help us update the chronological aspects of our memories. Yeah? When did that happen? Was I 10 or was I 15? You know? Or was it at the Iraq War, or is it right now? Yeah? This is disrupted. So the symptoms: inability to detach from intrusive traumatic thoughts or memories, and return to feeling body sensations or the breath. It's difficult, they get stuck in it. Sudden sense of reliving the event and being unsafe. Needing to stop practicing, leaving the room, and get otherwise distracted. If you had any of those, or no? Use soothing. You need to use soothing techniques. So usually with this is best to, if you don't have training in exposure therapy or exposure techniques, it's best to ask them to open their eyes for a few minutes, ask what's going on, talk. Don't just relax them, just talk, because as they relax, they still might be in that. Yeah? So open their eyes, distract them a little bit, ask what's going on, and use a soothing technique. So loving kindness is a good technique to soothe. Yeah. Sometimes it's good to open their eyes, but also touch things, or feel that they're here. If they have a cup of warm drink, also feeling the warmth of the drink, unless it triggers something else, just be careful. But exteroception means using external senses, not internal senses, if they get stuck in flashbacks. And psychoeducation about trauma. So that's your mission now, if you accept it, is to get a bit educated. Yeah? And this instruction will not self-destruct in 30 seconds. Keep it in mind. Yeah. So use progressive muscle relaxation. It's a good technique, although it can produce relaxation-induced anxiety if people don't expect it. So you can say to them, or sometimes even with relaxing like this, with the 16 muscle groups, we can sometimes still have flashbacks. You know, then do it open eyes, for example, or do it in a shorter fashion. If you don't have those techniques at your disposal, then look, and it's not a sales point here, but look at our website, and there are MP3 audio instructions available there. Have a look at it if you want. And you'll have the progressive muscle relaxation instructions. It's only 14 minutes, unless you've learned already. Yes, and loving kindness will prevent that sense of failure for them. Practicing open eye is important also to disrupt from that memory, and check if that memory stays outside the meditation. So the thing is, if you don't integrate properly the emotion during the practice, it might stick outside the practice. So it's good that they don't drop out now, and they practice in very small bursts, and every time there is a flashback, quickly that they go to the sensation and feel whether there's a predominance of mass or motion, of temperature or constriction, and to objectify it instead of personalize it. Yeah? To stay with what it is, even open eyes. So there's no flashback, you're in front of them, and stay with the sensation. So is it heavy? Okay, let's see how long that heaviness lasts. Stay there for a minute. Yeah? You don't need to make them laugh. It's just, by the way, there is a study demonstrating that laughing tapes associated with memories of flashback in veterans decrease PTSD symptoms. So if they associate laughter with trauma memories, it does quite a good job as well. Avoidance and safety behavior is another issue with trauma that you need to be aware of. So the symptoms are typically persistent dissociative states, so they can't pay attention, they can't remember things very well, and most of all, they can't feel very much. Yeah. And sometimes when it's severe or clinical level dissociation, they even feel a bit unreal themselves, or that the world is unreal. So this is derealization or depersonalization type symptoms. If they are in that state, you don't want them to meditate at this point. You want them to do progressive muscle relaxation, not mindfulness training. Pronounced fear of keeping their eyes closed, it's okay. Just train them to close their eyes progressively, not in one go, because they fear to lose control. Okay? And lose control over their memory. So open eyes to start with, but squinting a little bit, yeah? So they're not too distracted with the environment, and they can still practice maybe a couple of meters ahead of their knees. Yeah? And let the light come in so they don't get caught up in memories as easily, and then slowly close their eyes as they get used to it. It's a training. If they want to leave, let them leave, but make sure you talk to them first and check if they're safe and they're okay and so on. Postpone mindfulness. This is definitely one thing to do. If they're avoidance and they seek safety either by dissociation or otherwise, it's not the time to meditate. So use, as I said, progressive muscle relaxation, open eyes is ideal. And if symptoms are not intense but continual, use mindfulness or breath only, and maybe a little bit open eyes to start with. And that with the abdomen, it's wider. And this way, with the abdomen, they can also be aware of sensations in the body. Whereas here they're not, and it keeps on climbing up without their knowledge because they dissociate. And by the time they realize what they feel, it's too late, they can't control it. So stay with the belly, rise and fall of the belly. It's a gentler approach. It's less concentrating, but it's better than stopping if it's not too intense. Loving kindness provides the soothing effect we're looking for, and exteroception if needed, which means remember that you feel your feet on the ground or your buttocks or knees. Look also around, you're safe. You know, would you like us to open the door? You remember when you close your eyes or you semi-closed, you remember that the door's open. You know, you're always free and you're not stuck here. Poor inhibition. This is a tricky one. People are overreactive and they can be disruptive in a group. So you have that more with complex trauma or borderline personality disorder. So that's your heartache, unfortunately, in a group situation where you have people who just can't control it. So use exposure to these sensations. And sometimes, depending on the level of disruption in a group, you can't do that in front of others. You have to do that separately. So, I mean, there's no magic bullet here. If the person's too distressed, talk to them close to them, and don't touch them unless they give you permission. That's another thing with trauma to be very careful about. No touch, no hug, nothing like this. Stay with a safe distance for them to be safe, because they might have some memories of being raped, or you don't want to touch a person, you don't know what's going on. So safety first. So without touching, with a gentle voice, hey, just stop for a while, just have a rest. You know, maybe just either open your eyes or semi-open eyes and just relax. Think of something relaxing. Until the group is over, and then you take them apart. I don't mean that. You take them separately, talk to them separately, so there's no confrontation. Also, yeah, okay, so more or less I said that. Yeah. Allow them to leave if they need, but be very careful they don't leave in a crisis. They need to settle down first. If disruptive in a group, then prevent shaming or denial that they are disruptive. Because next week they might turn up and be disruptive again and ask questions. And it's not just normal trauma, this is more a personality trait due to complex trauma. So you have to talk to them separately and establish the rules. Yeah? And sometimes they shouldn't come to your group. You know, it's not ideal for them. So very kindly saying, you know, I don't think this is your ideal group here. This is not best for you. Okay, and interoceptive exposure, I will skip this because I mentioned that earlier a little bit and we're running out of time. So basically it's about exposure to 4 characteristics. There is no self in that. And we did a study that does that with chronic pain. Some of those participants were traumatized. Some by the pain, by the way, and some by the accident that created it. So due to co-emergence, you know, feeling body sensations during body scanning will obviously facilitate memories. If you target the co-emergence instead of trauma, just stay with these sensations, they decrease. If the person doesn't identify with them, doesn't react to them, they decrease. And that's a function of equanimity. Yeah? That's what equanimity is, to learn to see things more objectively, not take them personally, and not react to them. So this is the study I was referring to, and this is a typical filling in of that form where we use these 4 characteristics in someone with quite tremendous amount of pain, working with 2 sticks, and that's in twice 30 seconds. So it can be very fast. When you ask them, okay, close the eyes, just focus on the most intense sensation. Forget about trauma, just the sensation now. Yes, but my trauma, no, know your trauma, no, just the sensation, where is it? Well, it's in the stomach, but I have flashback. I know you have flashback. Stay with the stomach. What's in the stomach? Well, I feel tight. Okay, anything else? Oh, I feel heat in the cheeks. Which one's the stronger, the stomach or the cheeks? The stomach. Okay, stay with the stomach. Work with the strongest. Or what else than tightness? Oh, it moves and it squeezes, okay. It's like a dagger. There's no dagger in your stomach. I would see it. Okay, what else is there? There's a pin, there's something pressing. Okay, so let's say pressure, is it? Okay, so that's mass, but narrowed down to a small area. What else? Motion, temperature, solidity, cohesiveness? Okay, let's focus on this for 30 seconds. There's no more trauma there. There's no more me. There are 4 characteristics of experience. Okay? Now, I don't advise you do this if you don't have trauma training or trauma experience. Yeah? Leave it to people who are trained with trauma-based therapies. But if you are stuck, that's what I'm talking about. I'm not teaching you therapy, but I'm saying if you have a group and someone is starting to breathe really hard and you ask him what's going on, don't hesitate to interfere. You know, don't leave them there like a worm. You know, just ask them what's going on. Open your eyes. Oh, you know, I'm having these flashbacks. Okay, no worries. Okay, so let me guide you through this because they're there and then. Otherwise, this is not what I'm asking you to do, just as a routine exercise. Do you understand the difference? This is emergency situation. And then they might say, wow, what was that? I feel so much better. Then it's a winner because you say, next time you have a flashback, don't even go there. Go straight to the sensation in the body and work with it. It might bring more memories, that's okay. Stay with it. And if you don't want to do that, call me, I'll do that with you. But if they didn't feel relieved or if they still, you can see they're not well, etc., refer immediately. It's not shameful, it's noble on your part. It's not a lack of skills, it's not going to tarnish your name, it shows your good ethics. Yeah? Therapy does that. Therapy has 5% harm in it. Any therapy. There's at least 5% worsening in therapy for clients. So don't think it diminishes your wonderful skills or anything like this. Okay, so Okay, so added meaning, also people with trauma tend to add meaning. They don't, they don't just stay focused on the elements that are emerging or what happened then. They add meaning to it. They catastrophize. They add all sorts of features that didn't exist. They reconstruct their memory. If you look at, okay, here's a good. You want to have some fun, and at the same time learn more than you have for a long time. I believe that's what happened to me. Have a look at this video, YouTube video. It's free for everyone, for now, and it's called Memory Hackers. Memory Hackers. It's 52 to 54 minutes. It is worth it. When you see how we construct ourselves through memories, but also how that is fragilized by every re-stimulation of the memory. And memory will stick only if you reconsolidate them. If you don't reconsolidate memories, they transform. And when a memory is reactivated, for example through mindfulness meditation, you block the reconsolidation. You produce equanimity instead of reactivity. By blocking that reconsolidation of memory, your very memory of what happened during your trauma now changes. You can't remember being scared. You can't remember needing to avoid certain experiences. You can't remember being so distressing. Was it? And then your sisters say, oh my God, yes it was. It's funny, I can't remember it that way. I know it was rude. Rude? And that's how it happens. And, it's quite fascinating. So have a look at this. It will inspire you as well and give you some quite different ideas of how memories are formed. And you see them formed in a brain, in a rat brain. How memories pop up is quite fascinating. Sorry for the rat. But, So use exposure, control breathing, or progressive muscle relaxation. Again, to interrupt the ruminative thoughts. Precaution for minimizing harm to finish off this presentation. Well, be informed about symptoms of mental illness, please. Please. If you teach mindfulness meditation, if you teach all sorts of other things, I don't know. I can't speak, that's not my area. But if you teach mindfulness meditation, you ought to be informed about mental illness. Look at what typical symptoms of depression are. What are they with panic disorder? What are these symptoms? Well, there's a fear of having sensations in the body in case it turns into a panic. So they start to avoid sensations now. So you scan the body and they don't want to scan the body now. So they want to stay with mindfulness or breath. You need to know that. Otherwise they stay so long before they benefit. Another thing is always perform an intake assessment. So this is very difficult in a coaching environment. Who's going to do that? What I suggest in this case is that you design a short form. We have one in our work, but you can design your own appropriate to the context. Design a form and send it, even by email, to each potential participant or registrant to your course. And don't take them until you receive that form, please. You have no idea otherwise. Okay, this is not a clinical assessment, but at least if you write things like, a bit like the Vipassana centers do now, but a bit more elaborated than just, did you have a mental illness? Just say, what is it? Do you see a therapist? Are you taking medication? What are the symptoms? And write in big, confidential form, so that they know it's not going to go anywhere. And make sure you ask all the questions of interest. When was your last episode of depression or trauma? Yeah, do you know what I mean? So it's very important that you are informed. If you're not a therapist and there is, an active mental health condition, I really encourage you to refer on. Don't even take them. If the condition is active, if they are now depressed or clinically anxious, if you don't have training, don't go there. You're shooting yourself in the foot. Both because of the results, which can be it's all or nothing, or and because of your responsibility and its consequences.
What if someone's identified that they're having treatment currently?
They're being seen by a mental health professional.
But they indicate then that their therapist has recommended they take up mindfulness.
That's fine. It would be good if you could send a quick email or something or phone call to the therapist, say, oh, by the way, can you confirm, and just in case some material comes up, would you mind if I let you know, and ask the person if they give you permission to communicate with their therapist?
Because I've had quite a few.
Yeah. Oh, that's good. That's great. It's all good. But it's good that there is an open channel in case something happens, you don't know what to do. You can say, look, I'll talk to your therapist. Don't worry. Go home. Just leave it for now. Don't practice till next week. See students or clients enough. If you see them every 3 weeks and they have a history of mental illness, you don't know what's coming in those 3 weeks. Weekly is a good average, usually, but sometimes you might want to see someone in between sessions, between group sessions, very important if there are issues. Exclude students if they have if you run groups and they have severe social anxiety, they're gonna panic just because they're in the group, not because they meditate, yeah? Or if they have been, say, gang raped or abused by groups or assaulted or bullied by groups, you probably don't want them to attend a group. You want them one-on-one. If mild symptoms emerge, add one-on-one sessions, which is what I mentioned. If you are a therapist, provide psychoeducation on trauma, very important, so they know that they should expect perhaps some memories, but it's okay, provided they practice as you tell them, if you're a therapist. If you're not a therapist, refer to a trauma-informed therapist. Some are not, by the way. Not every therapist is trauma-informed. When not to use mindfulness, if you do not practice it yourself, that's the first thing. Don't even go there. You're right. It's very hard to understand an experiential technique if you learn it intellectually only through books. Or if you've done a one-day workshop or two-day workshop and you don't practice it. Client refusal or lack of interest, don't use it. It's not going to be used well and it might even be harmful. Extreme anxiety, severe dissociation, with or without anxiety, don't use it. Not now anyway, until this subsides. Overwhelming flashbacks, mania or manic episode, psychosis or suicidality, no mindfulness meditation. Therapist or no therapist, I would not advise it. Because you lose control over what they do when they feel that way. And loss of self-efficacy. They don't get any results. It's been now 5 weeks, no results. Why insist? It's best that they do something else. To sum up, we looked at the need for awareness in mental health issues. We clarified the active mechanisms of mindfulness through the co-emergence model of reinforcement. We look at normal versus adverse effects. Yes, we did case conceptualize the process. We also had an understanding, or hopefully we had an understanding and addressing trauma and other distressing symptoms during meditation, and just now discussed what to do or what not to do, rather, when people are in distress. I think we've passed the time. We don't have many time for questions, but maybe if there's 1 or 2 burning questions, and then... No? Thank you very much. Oh, yeah.
Can I ask you? Early on in the presentation, I think in the morning, the first session, you were talking about in the process of mindfulness meditation, not identifying with feeling and sensation, how that might help in a way with sort of ego reduction. But and later in the second session, you talked a lot more about the importance of sensations. I'm wondering you might just say something about the positive side of recognizing sensation as either a warning system or a precursor to a potential thought train that's going to follow, a proliferation that's going to follow.
Very much so.
And developing that wisdom to be able to recognize, oh,
thank you,
that
Gerald.
was that sensation.
Very good, excellent. So yes, thank you for that very timely question. If we consider that sensations are part of information processing, there is no choice. The choice is to allow ourselves to feel it or not to feel it, but sensations are there. That's how the brain processes information. If we avoid it to the extent of dissociating, for example, it backfires because by the time we are aware it is here, if we are, it is too late, it is too strong, and we react. But if we are able to increase the ability to feel sensations in the body through scanning the body, there's not many ways, by the way, of feeling sensations in the body. You either wait till they are very strong, or you go in there and try to investigate where are the subtle ones. If we are able to feel sensations when they are subtle, and we get used to this, then what the mind does, mind, I think, what the mind does is becoming increasingly able to feel subtle cues of distress before they become intense, which means that at that level of subtlety, we don't have to react. The disequilibrium state is not very pronounced, which means reaction doesn't have to be that big. We can simply acknowledge, oh, I'm feeling a bit of a discomfort there. I know what's coming. This is familiar to me. And you have signatures like this of interoceptive awareness. And you start to feel, oh, I know this is anger. That I'm feeling the agitation. I'm slightly sweaty and I'm a bit hot. Not too much, but it's starting. I better be careful. Okay? So this is in daily life. So the ability to self-regulate or regulate emotions is facilitated by increased interoceptive awareness or the ability to feel subtle sensations. And we see this again when people are recovering from mental health conditions. Their insular cortex increases in activation, in its activation. Insular cortex is where we feel sensations. It's what allows, us to feel sensations in the body. Now, this is just the normal day-to-day functioning. When it comes to our topic today, which is awareness of mental health and how do we approach this, then it's very helpful, isn't it? If you can think about an increased ability to feel subtle sensations when we have a mental health condition and meditate. Very quickly, we learn to detect those subtle cues which are associated with depressed mood, anxiety, or traumatic events, and very quickly desensitize. Very quickly. If we work at the level of sensations and not just thoughts like we do often in therapy, well, what's the evidence that when you walk in the supermarket you'll be attacked? I mean, you were in the Gulf War, but we're not in the Gulf War here. You know what? So the cognitive therapist will start looking at giving this almost embarrassingly useless form. In my view, I own that. You know, write all the evidence for and against your dysfunctional thoughts. It just puts people off, really, because they don't often do that unless they're very compliant or psychologically minded. So if they're psychologically minded, usually they need less therapy than others, so defeats the purpose. But basically, instead of going into the evidence for and against that I might be attacked in the supermarket, just scan the body. Just scan the body. What does it feel? Okay, it's a sensation of heaviness and tightness, squeezing. Okay, just take what is there. There's 4 characteristics. Is it mass, motion, temperature, fluidity or solidity? Those 4 elements. Yeah, let me stay there another few seconds. Hang on, darling, I'm catching up with you in a minute. Yes, just keep scanning the body and keep walking. There's no need to look for evidence of anything. Because we no longer look at the outside world as a cause of my reactivity. We look at the way we react to sensations based on that disequilibrium state. So you can go very fast, faster than standard modern therapy if it's appropriate for you to deal with it. Yeah. Thank you for the opportunity to clarify this. Any other question? Okay, so here are some resources you'll find on that page. There are books as well, if you want to be a bit more informed. I guess the one on the right is more for therapists, so I would not suggest, unless you're trained, I wouldn't go there. But the blue one is including issues of well-being and personal growth. So you can do your own program and undergo that yourself if you wanted to. This is mindfulness-integrated cognitive behavior therapy, not just meditation. So it's a bit different, but you might be curious. Anyway, the way we target those 4 elements is specified in there. But again, I warn against venturing into mental health disorders and putting yourself in this very unfortunate situation where you have to actually deal with something you're really anxious about. So protect yourselves and refer on. Thank you for your attention.